Hi everyone, my name is Jan and I'm a third year PhD student at the University of Birmingham. Thank you for coming to my talk about the fluid in the paediatric colon. Before I start, I would like to thank the EU PFI committee for allowing me to present my work. So this presentation is about the quantification of fluid volume and distribution in the paediatric colon by magnetic resonance imaging. When a solid drug is taken orally, it needs to disintegrate and then dissolve, so it becomes available for absorption. But during this disintegration and dissolution, the amount of fluid and its characteristics are important parameters for these processes. That's why it's important we have data on the gastrointestinal fluid, so we can increase our understanding of absorption and improve our biorelevant models. Especially for the colon, there's not a lot known, even though the colon can provide novel delivery strategies and it allows for extended release combinations. So there's a better patient adherence and it's more convenient for the patients so they can get on with their lives. Especially in children, not a lot is known, and it's quite hard to do clinical trials in children as these often face ethical constraints. So these three together clearly shows we need paediatric colonic fluid data. But how we do this? Well, magnetic resonance imaging has been used before to quantify fluid in the gastrointestinal tract of adults. More specifically, it's been used in the stomach and small intestine and colon for adults, and the stomach and small intestine in children, which has been shown on the EU PFI conference in 2018. It hasn't been used yet for fluid in the paediatric colon, so that's what I'm showing now. To do this, we had 49 paediatric MRI data sets, which we used before to quantify fluid in the stomach and small intestine. You can find more on this paper from 2019. We had children from the entire age range, from 1 week old till 16 years old, where we got MRI data sets from two sites in Birmingham and in Coventry. We also had two arms. So we had a fast arm and a fluid-fed arm, where children had to take 500 ml of a Mega Gold solution 1 hour before MRI was taken. This allowed us to have a fluid-fed population, which is not really representative of a high-calorie meal though. We collected demographics such as age, sex, and weight, but we didn't get the diagnosis or the height. In this table, you can see our demographic distribution, where we banded the children according to the ICH guidelines. So to extract fluid data of our MRI datasets, we use two protocols. So firstly, we would threshold our dataset with the CSF. So the CSF, or the cerebrospinal fluid, is free-flowing fluid in the body. So if we use those voxel intensities as a threshold for the entire dataset, then all the pixels or voxels with a higher intensity will also be showing free fluid. As you can see here, in all the red areas are free-flowing fluid. Then we would use MHJ to extract data on these red areas, and we can calculate the real area and multiply them by the z-axis, so we get the volume, and then we manually select all those areas as to be in the column or not. We can also have a 3D protocol. So in HOROS, we would make a 3D model of the MRI dataset, and then we would cut out the column and clean it up in Blender. And then it can calculate the volumes for us. So again, we would have individual fluid volumes for the entire dataset, but also data on pocket volumes, individual pocket volumes. And this is a nice video of such a fluid pocket in the ascending colon. And you can see when it progresses to the transverse colon, it's more separate pockets instead of one big one. So now the data. On average, the paediatric colon contained 0.8 ml fluid, whereas the mean volume was 22.5 ml. So this shows that the data is not normally distributed. We also observed a very high inter-individual variability from 0 ml of fluid to 168 ml of fluid, also shown here in this graph. There are 9 datasets with 0 ml of fluid, where there are 6 datasets with more than 60 ml of fluid. This high inter-individual variability was also observed in adults. So it's quite normal for this type of research. We can also see when we compare the different segments of the colon that the fluid decreases when you go from proximal to distal colon, both on population scale but also on individual scale, as you can see here. When we look at the number of excrete fluid pockets, or individual fluid pockets, every patient had around 16 pockets in their colon, but most of them are very, very small. Only 3.6 ml of those pockets were bigger than 1 ml. You can also see this here in these graphs where we show the count of pockets and the volume they take in. So only 9.6% of the pockets were bigger than 1 ml. But these 9.6 amount of pockets, they take up 94.5% of all the fluids in the colon. We also didn't see any influence of age, which was quite interesting, because you would expect that. So if you compare between the 4 ICH bands, you don't see any influence of age. Also on the individual data points, you don't see any influence of it. Only in the preschool population, so from 2 to 5-year-olds, there was a significant trend with the total volume and the volume in the ascending colon. But if we eliminate this outlier here, then this trend is gone. So we can conclude there's no, that age is not a good parameter for predicting the amount of fluid in the colon. Maybe height or body surface index or BMI would have been a better scaler, but we don't have that data. We also didn't see any influence of fat state or of sex on the data. You would expect there would be an influence of fat of the 500 ml of microgol solution they had to take. This solution was only taken 1 hour before MRI was taken. So maybe it just hasn't reached the colon yet. Also, when we look at the distribution of the excrete fluid pockets with age, you can see there's a lot of very small pockets, but then some bigger ones, but there's not really a clear trend. I have to say as well on this figure that the very big pockets, so bigger than 25 ml, are not shown because they would just distort the scale. When we compare to adults, because currently adult fluids are used in those models for absorption in the pediatric colon, we saw that the median was considerably lower, so our 0.8 ml of volume compared to 2 or 8 ml in adults, whereas our mean value, 22.5 ml, was nearly double that of adults, 13 ml, which are not shown here on this graphs. When we look at the number of pockets, we also see that all pockets is quite bigger than the ones reported in adults. But if we look at the physiological relevant pockets, we are comparable. We have the amount of pockets in children is comparable to adults. So future work for this would be to integrate this data into in vitro and PBPK modeling for pediatrics, so we can improve our predictions. We can also compare this to other pediatric cohorts if there's any MRI datasets laying around. And overall, we hope this will improve our understanding of colonic absorption in children, and then we can make better modified release formulations. So as a conclusion, this is the first study to quantify the fluid volumes within the pediatric colon based on our datasets. We saw that the median fluid volumes is considerably lower in children compared to adults, whereas the mean is nearly double. But we also saw a high inter-individual variability as with adults. We didn't see any influence of age or fat state or sex. And this also shows that we can use real-world MRI data to extract physiological data so we can improve our models, and then we can minimize the burden of such populations. I'd like to finish off with thanking my supervisors, Hannah Batchelor, Richard Honeyblow, Global Power, of course Ben as well. Ben was a bachelor student working on this project. He's been a massive help, so thank you, Ben. I also like to thank Heron and Emily, two radiologists who helped me with the anatomy of the colon. Also Dr. Eleni Papatasulu, who quantified the fluid in the pediatric small intestine. Of course, the two hospitals we got the MRI datasets from, the research participants, my funding body, Sartara Semsep, and of course, lastly but not least, the EU PFI committee. So thank you very much for attending my talk. I hope you enjoyed it. If you have any questions, I'm also presenting a poster, so feel free to find me there. Thank you very much.